Hello, everyone. Sorry. Looks like Dakota's here. Megan Squared, Stephanie, and how is it pronounced? Mapua? Mapu. Sorry. Okay, so we're just going to go over clarification. First of all, I'll throw out, does anyone have any questions? Hello?
You guys have any questions? No questions?
Okay. Any questions? That's what this is. This is a question and answer. So what questions do you have?
I think we need to clarify.
Yeah.
Like you guys have got this in the bag.
You got it in the bag? Because I mean, we're not going to go over unless there's a reason for it. So if not, this will be pretty short.
Can you guys go over, so like on the electrical versus inductive, sorry, I'm trying to look at so if you like scroll down on the clarification document. And it asks the questions specifically about which like ions.
So you're probably looking at the one that talks about action potential, is that right?
It doesn't say action potential, but yeah. Roughly, it's which ions are responsible for contraction and which ones are responsible for relaxation.
Yeah, that goes back to your action potential. If you remember that slide that had like a circle, like the action potential that went up, the phases, phase 0, phase 1, phase 2, phase 3. There are certain ions that go in that cause contraction. We're getting
you guys just review that, or do you want me just to review it myself?
I can't hear. Hang on, let me
say that again.
Right. So I just wanted you guys to clarify on which medications like correlated to those specific ions. I mean, or never mind. I don't know how to rephrase that.
So if sodium is, which phase is sodium going in? On page 545, which phase does sodium go in?
I'm giving you guys the answer. Say it. Phase 0. That's
phase
a zero.
Phase 0. Sodium goes in.
Phase 0.
And if you have a sodium channel blocker, what's it blocking? If you have a sodium channel blocker, what's it blocking? Sodium. So it's on that phase, and the phase 0 where sodium comes in, sodium contracts the muscle. Does that make sense, Stephanie?
The same thing with like the sodium potassium pump.
It's not the pump.
Yeah, I'm good.
Yeah. So which ions contract the muscle, the cardio muscle? Which ions relax it? And there was a slide that showed when it goes in, when sodium goes in, which is the contraction, and which ions come out, which is the relaxation. And then it starts all over again.
That's on page 545 of your book. So you've got the sodium that comes in that contracts it, and then calcium will come in, which prolongs that contraction. And then potassium comes in, and that's what makes everything relax. Okay.
Did that answer your question, Stephanie? Alt-tab.
And then as far as the drugs go, they're kind of self-explanatory. The calcium channel blockers are going to block the calcium. The sodium channel blockers are going to block the sodium. And then we've got that third one that prolongs the repolarization. I think that one actually works on phase 2, I think, but they call it the potassium one. That one's a little funny.
Is it Alt Tab to go back?
Alt tab, yeah.
And then do you pick the one that you want?
Yeah, so you can just do tab again. There you go.
So Stephanie, did that answer your question? Could you tell me yes or no, either in the chat or?
Okay.
Okay. Any other questions? Any other issues?
So guys, remember there's drugs that work for angina. There's drugs that work for dysrhythmias. There's drugs that work for heart failure. But then there's also some that don't cross over. Does that make sense? So some work for multiple, some only work for one or another.
So we're awfully quiet. Last week we had a ton of discussion. Help me to understand what's going on. Or what it is. Go ahead, Leslie. Sorry, say it again.
No, you're okay. Okay. So digoxin affects the contractions of the ventricles, right?
Digoxin.
Yeah.
Okay, does anybody want to chime in there while we pull up from the book?
Well, okay, let me continue. So I'm pretty sure it affects the contractions of the ventricles, but then it's also given to a patient who has AFib, but that's a problem with the atria, right? So why would an increased contraction of the ventricles help with someone who has AFib?
Because AFib stands for what? Atrial
Fibrillation.
fibrillation. So it means the heart is not beating correctly. It's fibrillating. It's like shaking. So
So
when
is it shaking all around, or is it shaking just in the atria? Like just the atria aren't doing a full contraction?
if you start in the atrium, it affects everything else. The atrium
Okay.
gets mixed up. Does that make
Okay.
sense?
Yeah, that does.
That's why it's regularly irregular. Atrial fibrillation is regularly irregular. It's
Got
always
it.
it's always associated with a QRS. It's a narrow QRS. So the conduction is going fine, but it's a problem with the SA node. It's not beating properly, so therefore it's just shaking. So that's why digoxin is prescribed to help the atrium calm down so that it can increase the contractility. Am I right?
I don't see anywhere where it says it's works on the ventricle.
It's
Slide 48. It's slide 48, I think, in your PowerPoint.
All right, hang on. We're pulling up the PowerPoint. If you go to page 535 in your book, there's a whole big thing on digoxin. It is contraindicated in ventricular fibrillation. So that's VFib. That's when your ventriculars, the ventricles down below, are fibrillating. Digoxin will do nothing because it's on the atrium. And I think you said that, Leslie.
Okay, yeah. Just in the PowerPoint, it says that it strengthens the contractions of the ventricles.
All right, hang on. We're checking it.
So it increases the myocardial contraction stroke volume. So that would. I don't know why it's having such a hard time pulling that up.
Hang on. We're pulling up the PowerPoint.
You're okay.
I thought what digoxin did was so it inhibits the sodium potassium pump,
Mhm.
and then it increases the influx of calcium, which makes the cardiac muscle contract.
Yeah.
So that would mean it does strengthen the contractions for AFib.
Correct.
Correct?
Yeah.
Yeah. Did you hear that, Leslie?
Yeah, I did. I'm just wondering then why does it say that it affects the ventricles?
Because I'm human. I'm trying to look it up. My computer is not working very well. That's why we have these reviews.
Did
My
that
humanness.
yeah, because we're all human. Did that help?
Yeah. Yeah,
Stan?
that's great. Thank you.
Okay.
I got it. Let's address.
Hang on. She just pulled it up. Okay, so while we're putting it up, let's talk about number 19. Foods high in potassium, like grapefruit. How do they adversely interact with calcium channel blockers, beta blockers, and antianginals?
Okay, so sorry, let's go back because it says it's used for AFib because it helps slow the ventricular rate by blocking the number of electrical impulses that pass through the AV node to the ventricles.
Wow, that's amazing, Brooke. Thanks for that comment.
What was the comment?
When we get test questions wrong, can we say we are just human?
Touche, Brooke.
Yeah. Really nice. Super nice.
Well, if you think about AFib, that's the SA node going crazy. So it's sending all the conduction through the AV node, right? Because it goes SA node, AV node, and then your bundle His. So if it's controlling that AV node on how much impulse it's getting through, it's going to slow the rate of the ventricles, and also make them contract slower and stronger.
Yeah.
So that is correct.
Okay, thank you.
If anybody is confused, please speak up.
Yeah, please speak up. If this doesn't make sense and you're just like, yeah, okay, fine, whatever, I'm out of here. Okay. But we want you to be successful. We want you to understand. And if we've made a mistake, we'll own up to it and we'll change it. But we want you to understand so that when you go into the test, you don't have to say, yeah, I got it wrong because I'm human or because the PowerPoint was wrong. But you're understanding what atrial fibrillation is and how that medication works on the atrium, which then affects everything else. Does that make sense? Okay. Yes? No?
You guys got it?
Do you understand here in the class? Okay. All right. Anyone else? Is everybody else understanding the question about what digoxin does, how it acts on the atrium, how it slows down, increases the contractility of the muscle, which slows down the rate and makes it beat stronger? Is that clearer? Can you respond in some way? Thank you, Amy. Okay. Is it clear to you, Leslie? Okay. Thank you. Appreciate it. Okay. So, are we clear on which ions go in the contraction and the relaxation? Because that's on pathophysiology. That's one of the objectives. Anything that we put on the clarification document is important.
I do have a question about that.
Okay.
So I was just reading about calcium channel blockers, and it just says, and I mean, same thing with digoxin, how it talks about calcium is the thing that causes the contractions, but also the sodium potassium pump. So do sodium and calcium work together to cause the contractions? Because I also know calcium prolonged contractions.
Yeah.
Is that right?
Yes.
Okay,
Yeah. So sodium starts it, calcium comes in, prolongs it. So they do work together for a contraction.
Okay.
And then potassium helps release it. And that goes back to your sodium potassium pump. But it's just, we're talking milliseconds here.
Yeah.
Does that make sense? And this is the actual contraction of the muscle. Okay. All right. Okay. So what are some teaching you want to give your patients about the medications that we talked about? Don't take it with Viagra.
Don't take
Okay.
Viagra.
Yeah, don't take a Viagra. Right. That's good. What else? I'm going to try and go back to this document here so we can scroll up a little bit.
Nitroglycerin, Viagra, no bueno.
Yeah. Anything else?
Death, my friends, death.
Yeah, it is. It really is. Okay. What are some other teachings you would do?
Don't take dopamine and dopamine orally. you should take those like IV. 'Cause
Dopamine and dobutamine are IV. So if
Yeah,
you get
they're
a
not
question
available
about PO, yeah, click no longer applies or something. Okay. How do ACE inhibitors and ARBs treat heart failure? What can you tell me about that?
Maybe that's really good for any medication, really.
Right. Yeah, exactly.
Especially ones that are going to affect your blood pressure, your CNS, anything like that. So yeah, that's a good one, Amy.
Yeah, and it's true because like I took care of a patient who took too much of her medication, thought she had taken it, or she didn't think she had taken it already, and she had. So she took a double dose. And so what would you think happened to her blood pressure? Yeah, it tanked, and then she went to go to the store. So guess what happened?
You fainted.
She hit a tree. Yeah, she hit a tree. And so then they brought her in, and guess what? Her heart rate was 40, okay? She was on a beta blocker. Her heart rate was 40. And trying to get her heart rate up until we finally figured out, we ran some tests. Oh, honey, you took too much medicine. Guess where she ended up? ICU. So it's a real thing. So good job, Amy. Okay. What are non-pharmacological ways you can treat heart failure and angina? Okay, stress. What else? Don't be obese. True.
Right. Emma,
Yes.
if that hurts, don't do it.
Exactly.
But I tell my kids, they're like, it hurts when I do this. I'm like,
You
don't
betcha.
do it.
Less than 2 grams of sodium a day. Here's something really fun to do. Look, everything that goes into your mouth, take a look, especially if it comes from a package. See how much salt is in there. You guys are like young, healthy, thin. Everything's great. Huge amounts of sodium.
Oh,
Yeah.
top ramen is huge.
No snow blowing. You got it, Emma. Yep, that's
Top
right.
ramen is a lot of sugar, a lot of salt.
Yeah, it really does. Do you guys feel like when you take too much sodium, do you feel like your hands kind of getting a little puffy? Or maybe your feet? Yes or no? This is where you respond. Yeah, so it's true because you're retaining sodium. And remember, as goes water, as goes sodium, as goes chloride. Sodium chloride, they love each other and they follow water. Okay.
Emma, with the snow blowing, I was reading not really an article, just a little thing today, and it said that in 2016 there was a huge increase in cardiovascular events after the 2016 presidential elections.
That goes back to stress, right?
I'm telling you.
It is, yeah.
The second week of November, we're going to have a lot of CV events.
Right. When you guys are at work, look how many heart attacks are coming in and how many MIs, okay? And then with this first snow, not only do they have heart attacks, is when we get fingers cut off. You'll see it in the ER because it's like, you stupid idiot, don't put your hands in the snowblower, thinking because it's stuck, and then they unstuck it and it starts to go again and they lose their fingers. Okay, so what are some other non-pharmacological ways? Okay, we talked about stress, talked about salt. What else? What do they tell you to do? Come on, guys. This is exercise. Right. Exactly. Okay. What else?
If only you all online could see me.
Stop smoking. Exactly. Okay. These are things that you guys know, but guess what? They're going to be on questions. Okay. Because you're going to be educating your patient. Okay. Low fat food. Exactly.
Especially the saturated fats.
Saturated fats. Good job. Okay. When is adenosine indicated and how would the nurse administer it? We don't know.
Yeah.
Yeah.
It is IV.
Yeah. Patient has to be laying down.
They have to be laying down. But what's the half-life of adenosine, guys? Less than 5 seconds. So if you're giving it slowly, by the time it hits the heart, because it's given IV, dead. It's not working.
Not the patient.
Not the patient, the medication. The patient's still alive. We're with a super fast rhythm, but the medication is dead. It's not, its half-life's gone. So it can't do its job. So do you remember the video? Well, how did they give it? They gave it IV, and then what happened? Like right after they pushed some fluid? They used a stopcock?
A
No?
lot of times, if you have more people in the room, like one person will push the adenosine, the other will push the flush. Like you usually have two people saying 1, 2, 3, go, and then they'll go.
And a lot of times in the ER, we'll have them raise their hand. You know, I'll actually hold their hand. I'm the one in charge of the flush. The doctor administers it right by the hub. Okay. But think about it. Everything's going back to the heart. If your hand is raised and it's 1, 2, 3, she pushes or he pushes and I flush. It's that quick. So it needs to be given quick. It's IV. And the nurse administers it fast. And yes, you're right, Emma, patient's got to be laying down because it chemically stops the heart and restarts it to convert the rhythm. Are we good?
Amiodarone is given slowly.
Amiodarone is the slow one. And that's hard. Adenosine,
I know,
amiodarone, they're both A's. We're human. Yeah, amiodarone is slow. Adenosine restarts the heart chemically when it's in a tachycardic rhythm, SVT or PSVT. When it's going so fast, it can't pump well. Does that make sense to everyone? This is when you
make sure you tell the parents, well, if they're there.
Yeah.
The patient, if they can see the monitor and their family that's there, that their heart rate on the telemetry will stop.
Yeah. That's why they don't feel good. What foods are high in potassium? Go.
Bananas, potatoes.
She said spinach.
And what?
Spinach.
Spinach, okay. Know what foods are high in potassium. Because why is that?
Avocados are delicious.
Yeah, why is that important?
Did you kill yourself?
Okay. How does potassium interact with the medications that we're talking about? What medications do the nurse need to kind of monitor for potassium? Like, it's too much. Some of the side effects is high potassium. You might not know that. We'll get that to this week.
Well, if you have too much potassium, doesn't it slow your heart rate?
It makes the heart irritable. High potassium makes the heart irritable. Yeah. And so it can throw it into dysrhythmias. Yeah. Okay. What are, let's see, what are drug classifications to treat angina? What drug classifications and medications under them treat angina?
Good job, Amy.
Yay. Okay. And how do they treat it? How do the medications treat it? The beta blockers and calcium channels, what do they do?
And cause vasodilation.
Calcium channels or the beta blockers? Okay. They decrease in oxygen demand. The nitrites are vasodilators. So what would you expect to see that you would educate your patient on nitrites? Like nitroglycerin, you just gave them a nitroglycerin under the tongue. What are some common side effects that the patient might experience that you're going to educate them on? Headaches.
What they're saying, yeah.
Oh,
Yep.
yeah.
Hypotension.
I'm not paying attention to them. I'm paying attention to you guys.
Yeah. And it does. And we're talking about the heart. So it's a decreased demand of oxygen that the heart needs because it's dilating, not violating. It's dilating the cardiac arteries. Does that make sense? so that the heart doesn't work, has to work as hard to get oxygen. That's what chest pain is when the heart isn't getting enough oxygen, the actual heart. Okay, does that make sense? This is when you say yes, no, screw you. No, I'm just teasing. Okay, anything else? What would you want to review on your CAM presentation on garlic and ginseng? What do you think some questions might be? Okay, anticoagulants. How long have they been around?
Ever and ever.
Forever, right? Interactions, you bet. Interactions between drugs and herbs. What are the best things that
Herbs and diseases.
that garlic and ginseng are used for? What are some of their benefits? Because a lot of people use them.
Keep vampires away. Isn't that what Mark said?
Right. Somebody, Mark said vampires. Okay. Yeah. 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 Especially the ginseng. Okay. Any other questions? What are some side effects and contraindications for medications? In number 4, we talked a little bit about that. Okay. What drug classifications and medications treat dysrhythmias? They don't treat
some of them.
some, but most of the time there's a better class of drugs for dysrhythmias. Right. Yep. That's right. Antidysrhythmic is the answer. And now here's the next question. What are some medications that are they're antidysrhythmics?
But under antidysrhythmics, you have your sodium channel blockers, your beta blockers, your calcium channel blockers, your drugs that prolong repolarization. So those are your potassium blocking ones.
And
those are the classifications.
And what medications did we go over? What are your prototypes for dysrhythmias? Very nice drugs. Thank you. Verapamil, nifedipine, and diltiazem.
Nifedipine's not used for dysrhythmias. It's used for angina.
So, aren't they also
The verapamil and diltiazem are number 1 choice for antidysrhythmics. But nifedipine works really well with anti-anginals.
So wasn't there, do you have a thing on very nice drugs?
Yeah, so it was the anti-anginal. It's the very nice drug.
Okay, the anti-anginal is very nice drug. Sorry, I thought they were the anti-dysrhythmics.
And the dysrhythmics is just varied drugs.
Remember, there's 4 classes. There's 4 classes of anti-dysrhythmics. There's the class 1, class 2, class 3, class 4. What's class 1? It's on page 545. Sodium channel blockers. What's a sodium channel blocker? What medication is a sodium channel blocker?
We're going to look at the 1B.
That slows the conduction and shortens the repolarization.
Amy and Megan got it.
Yay! Okay, class 2 beta blockers for atrial flutter, atrial fib, and SVT. What are some of those that are beta blockers? Remember, those end in LOLs? There you go. Okay, class C. They prolong the action potential. They're life-threatening atrial and ventricular dysrhythmias, and they're resistant to other drugs. Class C. Megan's typing. That's where your amiodarone comes in. And class 4, your calcium. So I'm on page 548, class C. Amiodarone increases the refractory period, recovery time, and prolongs the action. This is the cardiac cell. Class 4, calcium channel blockers. That's the V or verapamil.
Yes, Amy. Adenosine. Oh wait. Yeah, it's in class 3, right?
Should be.
Yeah.
I was going to say adenosine, but I'm like, I didn't want to be wrong because you guys are like sharks. Good sharks. Okay. Anything else? Any other questions? Mark, haven't heard from you. Chelsea, I don't think I heard from you. Ashley, haven't heard from you. Stephanie's still hanging in there with us. Any other questions? Okay. Do you feel confident for tomorrow's test? This is when all of you say yes. Okay. All right, so we'll continue doing these if you feel they're helpful. We're trying to help you be successful. Last week, the test scores were phenomenal. Okay. Hopefully, we're going to do, like I said, it's these next 2 units, tomorrow, the one last week, this week, I think are the toughest ones because the week after that is GI and it kind of levels off. So hang in there, be kind to yourself, put your, nose to the grindstone. I know it's hard, but you can do this. You can do this. Okay? Any other questions? We're good? Okay. Then we will close this out then. Wait, the boss says, hang on.
Oh, there's just more comments.
Hang on.
It might just be a thing right here. Oh,
Okay. All right. Perfect. Thank you. Good luck on your test tomorrow. We'll see you tomorrow. Make sure you want to pause the recording. You can resume by selecting the record button again. Okay, so yes, I want to pause it, right?
Yep.